Assalamu alaikum. My name is Dr. Tarek El-Gamasi. I'm professor of pediatrics and neonatology. In the next 30 minutes or so, we are going to discuss three subjects: neonatal anemia, neonatal bleeding, and neonatal screening. The intended learning outcomes of this presentation is to know the commonest causes of neonatal anemia and how to manage a case of neonatal anemia. And the second, the commonest causes of bleeding in neonates, and to understand the hemorrhagic disease of newborn. And lastly, to have a whole idea about neonatal screening. In discussing anemia in neonate, we have four important subjects. First, the physiological anemia of neonates and anemia of prematurity. And the second commonest causes of anemia in neonate is blood loss, whether this is antenatal or postnatal. The third cause of neonatal anemia is hemolytic causes. The commonest among them is Rh disease of the newborn, sometimes called hydrops fetalis, ABO incompatibility, and G6PD deficiency in the neonate. The fourth cause of neonatal anemia, which is the rarest among them, is bone marrow failure. The clinical picture of neonatal anemia include pallor, which is the commonest presentation, followed by apnea and desaturation. The neonate may appear tachypneic and tachycardic. In severe cases, the neonate might have acidosis, hypotension shock, up to cardiopulmonary arrest in severe cases. The commonest cause of neonatal anemia is physiological anemia of neonate and anemia of prematurity. Physiological anemia of neonate usually occur around the 6 weeks of life due to cessation of production of erythropoietin, because the baby now is inspiring the air, which has higher oxygen saturation compared to the blood which circulates through the placenta. And the RBCs of neonate contain hemoglobin F, which have shorter lifespan. Anemia of prematurity is an exaggeration of the physiological anemia of neonate, and these babies usually have repeated blood sampling and they have vitamin E deficiency. So the anemia will present earlier and will be a little bit severer. The second group of causes of anemia in neonate is blood loss, which could be due to antenatal blood loss or postnatal blood loss. The commonest causes of antenatal blood loss in neonate is feto-maternal transfusion, when the blood from the baby goes through the placenta to the maternal circulation. So the baby will be bleeding to his mom circulation. Or twin-to-twin transfusion, if there is communication between the circulation of the two twins through the placenta. So one twin will have his blood moving to his twin brother. So one of them will be anemic, which is a donating twin, and the other one will be plethoric, which is the recipient twin. The third cause is prolapsed cord. Cord prolapse will lead to rupture of the cord during delivery, and the baby will lose blood during delivery, and he will be born anemic. Postnatal blood loss occur when the neonate have bleeding inside his head, which is intracranial hemorrhage, or from GIT, like hematemesis and bleeding the rectum, or through his lung, like pulmonary hemorrhage, or with fracture femur. This photo shows two twins. One of them is small and pale, which is the twin to the right. The other one is bigger baby and more reddish or more plethoric, and this is the recipient twin. And this is a cut section through a brain post-mortem. The right side of the brain shows large blood clot through the right ventricle. This is intracranial hemorrhage or intraventricular hemorrhage in neonate. The third common cause of anemia in neonate is due to hemolysis. The hemolysis might be due to a cause outside the RBCs, which we call it extracorpuscular defect, or a cause within the RBCs itself, and we call it intracorpuscular defect. Examples of extracorpuscular defect is RH disease of the newborn, hydrops fetalis. This will be discussed in depth with neonatal jaundice. And ABO incompatibility. In this case, the baby will have blood group of A usually, or B, but his mom will have blood group O. His mom antibody, which is anti-E and anti-B, will cross the placenta to his circulation. It will attach itself to the RBCs, leading to hemolysis of the RBCs. And lastly, sepsis. The intracorpuscular defect is a defect within the RBCs itself, which include glucose 6-phosphate dehydrogenase deficiency, alpha thalassemia, and congenital spherocytosis. All of these causes will be discussed in depth in the hematology